Hi, I'm Dr. Lila Meribi. This year, as part of the SVS podcast series, we're adding profiles of our members. I'm very glad to have had the opportunity to learn more about our treasurer, Julianne Freischlag. I first met Dr. Julie Freischlag when I attended the UCLA Review course in vascular surgery. She hosted a reception for female vascular surgery fellows and the faculty who were involved in the course. There were only about 15 of us at the table, but today, that same group of women in vascular surgery fills rooms. She inspired a grassroots movement where we could network and continue to inspire and support each other. Today, it is a rare national or even regional meeting that has not followed this lead and provided a women's networking forum. This was not Dr. Freischlag's first contribution to academic surgery. She served as an assistant professor of surgery and vice chair of the section of vascular surgery at the Medical College of Wisconsin. Regarding her move to Wisconsin from UCLA, she commented that she found it helpful to view opportunity as an adventure and in a positive light. Her moving to Milwaukee was sort of a homecoming, having grown up in the Midwest, and was almost moving home. Her positive feelings about the move were bolstered by not only a great opportunity with a mentor, but also the opportunity to gain leadership experience at the Veterans Administration Hospital. Prior to returning to UCLA where she trained, she earned a promotion to full professor of surgery. Along with this academic rank, she was elevated to chief of the Division of Vascular Surgery and director of the Golda Goldschmied Vascular Center at the David Geffen School of Medicine. The move back to Los Angeles found her in a very different situation than when she relocated to Wisconsin. Now she had a husband and a young child. This move required a balancing act between her family and her job. She describes that even in the face of a great job, perhaps she looked at options sooner than if both personal and professionals were in sync, illustrating the need to incorporate personal life with professional options. I discussed the issues facing vascular surgeons overall, as well as women in vascular surgery with Dr. Freischlag. The biggest change that she sees in vascular surgery is how the decision to go into vascular surgery and what defines vascular surgery has changed over time. The preoperative and postoperative cognitive issues haven't changed, but the options for patients have. When Dr. Freischlag made the decision to pursue a career in vascular surgery, all the operations were big operations and everyone did everything. There are now more options today for both patients and for the practitioners who choose to specialize in vascular surgery. Today, instead of doing everything, many surgeons subspecialize. Some do thoracic outlet, some do thoracoabdominal reconstructions, and some do extensive carotid stenting. One vascular surgeon doing all of these is becoming less common. This degree of subspecialization is more common to see at larger institutions. Some in our specialty struggle with this concept. Is a vein surgeon or a carotid surgeon still a vascular surgeon? Her answer is a resounding yes. Also, now only a small fraction of vascular surgeons still perform general surgery as a routine part of their practice. As for women in vascular surgery, she recalls when the SVS Women's Committee put forth a slate of women for all of the officer positions a few years ago. Amy Reed delivered the slate, and the irony was that Amy's name tag didn't display her name, and someone had to ask her who she was. No one has to ask her that anymore. When this occurred, there were a limited number of women on committees and no officers. Now, women are present on every SVS committee, and there is a woman on the executive committee, Dr. Freischlag. Although progress has been made, women are still underrepresented in leadership roles. But she notes that women now have numbers, where 10 years ago there were no numbers. There is also now the recognition of need for women in all roles of our society. She anticipates that it will take another 10 years to develop equal numbers of women in division-leading roles. She notes that one of the nicest features is that as a group, the women in vascular surgery are incredibly supportive to each other. As for her career, she's had an amazing experience at Johns Hopkins and her family loves the area. She can't imagine leaving. She knew she wanted to lead a vascular division, but wasn't aware that she wanted to lead a department. Her transition to Johns Hopkins has uncovered a real passion of hers in faculty development. She stresses that good partners, both personal and professional, make any job a pleasure.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.